Hello, and welcome to our Tush Talk about navigating the emotions that come up throughout caregiving. My name is Chelsea Butler, and I'm a patient support specialist with Colorectal Cancer Canada. Today, I am joined by Christine Speck with Gilda's Club. Christine is a registered social worker with 11 years of experience supporting people impacted by critical illness or loss. Thank you so much for being here with us.
Thanks, Chelsea. It's great to be here.
All right, let's jump right into the questions. What does it mean to be a caregiver?
It's a great question, and it's a really big question, and we could probably spend a whole hour talking about what it means to be a caregiver. But really, when I think about what it means to be a caregiver is I'm thinking about assisting with the physical, emotional, and practical needs of another person. So if we kind of break that down a little bit, the physical parts can be things like assisting with activities of daily life, like bathing, dressing, and so on. The emotional piece can be things around support, validation, active listening. And then the practical piece can be things like scheduling appointments, medication management, communicating and coordinating with the medical team or with family, friends, a lot of problem solving that goes on to that piece. And the amount of involvement really depends on the circumstances and the nature of the relationships. But one thing I can say to kind of summarize is that our caregivers wear many hats. And then also, just because you're not physically caring for someone doesn't mean that you're not a caregiver. At Gilda's Toronto, sometimes we have people come in who have someone in their life with a cancer diagnosis, but because they're not physically there or doing those physical, assistant with that person, they say, well, I'm not really a caregiver. But if you're supporting someone emotionally, physically, doing coordination, you're still a caregiver.
I like that. That's a really great definition and overview. Thank you. So then what is the difference between being a caregiver for, say, your spouse versus a parent or sibling in terms of some of the emotions that might come up during the caregiving process?
Yeah, absolutely. And I think, again, there's no sort of blanket statement, but I would say that because the relationships are different, the emotions may be different. So a lot of it really depends on the individual person who's doing the caregiving and the relationship to that person who's receiving the care. So when we look at when we think about parents, as adults caring for a parent, there's a role reversal that happens, right? So we think about, many of us think about our parents as the ones who take care of us, the ones who give us advice. Our go-to, even as we're adults, we often still go to our parents to get support and validation. And so there's that role reversal that happens, and that can be challenging for both the caregiver and for the person receiving the care. So sometimes, a person who's being cared for by their adult child may not like to be told what to do or to be given advice or to be questioned on what's happening. And that sometimes can cause feelings of frustration and resentment. On the other hand, the adult child who's providing that care may also get frustrated if they feel like what they're doing isn't being appreciated or they're not listening sort of to their advice. When we look at caring for a partner, again, it really depends on the relationship. A lot of partners talk about, it's an expression of love and caring, but others may find it's challenging caring for a partner because that person may be the one that they would normally go to get support and validation. And now they're feeling a little isolated. They're feeling like, I can't go to this person and say, I'm frustrated, I'm upset, I'm angry, because that person who's receiving the caregiving is already going through their own difficulty. So that may be challenging. And then in terms of siblings, again, it really depends on the relationship. It could be any of the above that I sort of talked about. I think that, siblings generally, I shouldn't say generally, but, often aren't in that caregiving relationship with one another. So it may be sort of navigating some uncharted territory for those siblings.
Yeah, it sounds like it can be stressful, which leads to my next question. According to research, about 15% of females and 10% of males experience stress while performing their caregiving duties. Has that been your experience? Do you have any advice for that?
Yeah, absolutely. I think that, in our experience at Gilda's Toronto, we find that the percentage of caregivers reporting stress is much higher. Our research has shown that about 50% of caregivers report feeling a loss of control over their own life, and about half report worse anxiety than the national average.
Yeah, that sounds about what we have reported to us as well. Also, approximately 20% of caregivers experience depression, which is actually twice as much as the general population. What are some signs of depression that caregivers can look out for?
Yeah, definitely. Again, sort of to categorize, sort of put them in some categories, we can look at sort of physical, emotional, behavioral, and cognitive signs of both stress and depression. So things like when we think about physical aspects of stress or depression, things like headaches, body pain, insomnia, fatigue, and sometimes a change in appetite. So that could be an increase in appetite, or just this feeling like I don't want to eat anything at all. Emotional. So in terms of stress, sometimes caregivers will report unusual emotions that they didn't normally have. I've had, members come to Gilda's Toronto that said, I'm really a patient person normally, and I'm caregiving now, and I'm finding I'm really starting to feel impatient or irritable. So sometimes new emotions. Also, there can be difficulty regulating your emotions, like anger. Things to watch for in terms of behavioral changes, an increase in substance use, is there more alcohol intake or more marijuana use, for example, and cognitive changes or things to watch out for, difficulty making decisions or processing information. And then specific, like those are sort of leading into stress, but then signs of depression. All of those things are sort of warning signs. But in addition to that, feelings of sadness or hopelessness and a lack of interest or pleasure in activities that you once enjoyed. Those are all sort of cardinal signs of depression.
Okay, yeah, thank you. And then are there any ways that you can sort of prevent depression throughout the caregiving journey?
Yeah, it's a really good question. I'm not sure that we can really prevent depression, but I think there are ways that we can help ourselves while we're caregiving. So things like self-care, which I'm sure we'll talk about in a few minutes, talking it out. So that can be formal or informal, calling a trusted friend or getting more formalized sort of counseling or support. Distraction can be really helpful for mitigating stress and depression. I had a member come to me, and she had a cancer diagnosis, and she was talking about, she had a lot of uncertainty and stress and worry. So she started working on Lego models. And I thought that was a really interesting coping strategy, because she said it required some focus and attention, which would distract her from her stress. But it wasn't a big project that she had to take on. She could kind of go to it and work on a little bit at a time when she had some time. And so I always say never underestimate the power of distraction. It can be a really healthy coping strategy for stress and anxiety and depression. Asking for help. I know for some people that can be really challenging, but recognizing that we all have limits. So going and asking for help with caregiving, even in some small ways. Taking over some tasks. You can think about things like considering respite for the person that you're caring for, which will give you a little bit of a break to kind of regroup and re-energize yourself. Taking a break, getting some exercise if that's possible at all. And of course, always thinking about eating as in as healthy a way as you can.
Yes, that's all really great advice. So who would a caregiver reach out to if they want to be assessed for depression? What kinds of professionals can support a caregiver through depression?
I always suggest that if people are feeling depressed or they have other kinds of things like a lot of stress and they're feeling burned out, always start with your family doctor. That's the person who knows you. They're really well connected in the community. They can kind of assess how you're doing and then make some recommendations on, what is going to support you in the best possible way. The other thing caregivers can think about is going to the treatment team of the person that they're caring for. So there could be social workers, nurse navigators on that treatment team. They can, again, connect you with community social workers, psychologists, psychiatrists, and other mental health counselors. They may also, depending on where the person is being treated, They may also have programs at the medical center or the hospital where they're being treated. Sometimes they have educational programs for caregivers, things like mindfulness and meditation, which we offer at Gilda's, but other facilities may have those kinds of programs. So it's always worth connecting with the healthcare team. And then the other is, again, looking at respite care. So that can be also something that could be of help during that situation.
Okay. Yeah, that's great. Moving over to some more specific emotions, some caregivers have expressed that they often feel anger given their situation, but they feel like they can't express their anger. They don't feel right doing it. They're kind of ashamed of it. Have you heard the same from other caregivers, and what are some healthy ways to express that anger?
Yeah, absolutely. I think anger is a really common emotion when someone's caregiving, and I think in our society we're not really comfortable with that emotion. And there's, as you said, there are emotions that go along with that. That I don't have a right to feel angry, or I feel shame because I do care about this person. I'm providing care for them during a really difficult time for them, and I'm embarrassed to talk about my anger. So it really, just to validate that, it's a really normal part of caregiving and often a result of stress. Similar to what I mentioned before, talking it out. Sometimes just hearing from someone else, yes, I'm a caregiver and I experience anger as well, is enough to make us feel like, okay, I'm not alone in this. I'm not isolated. This is normal. So things like also exercise, distraction that I talked about earlier, having a change of scene when you're feeling angry can really help to mitigate those feelings. Trying to reduce stress, and even when I say that, I know it can be very difficult for caregivers to reduce their stress. But kind of looking at what are the things that they're finding the most stressful that may be triggering their anger, asking for help around that if possible. One of the tips and one of the strategies that we suggest to caregivers at Gilda's when they talk about that they're feeling angry is to kind of stop in that moment. This is just a really practical suggestion. Stop in the moment when you're feeling angry, take a pause and a breath before reacting, and reminding yourself of that. And even if you have to remove yourself from the situation, if you're caring for someone and they don't want to take their medication and you're really angry and you just want to say, you really need to take your medication, take a breath, even step out of the room and kind of regroup. You can always say to the person that I'm going to come back and we can talk about this, but right now I'm feeling really emotional. I'm feeling really upset. So I'm just going to take a pause. You can come back to that conversation. Other caregivers have shared things like having a physical outlet for anger. So it may sound silly, but it does work. Yelling into a pillow, running on the spot. I've heard people say that I bought a little punching bag, and when I'm feeling really angry, I just punch the bag, for a few minutes. Having that physical outlet to express that anger in a healthy, positive way also can just really help us to calm our emotions down.
Yeah, I've also heard too from several people, they say anger is a secondary emotion. So you may not be angry at the person, but sad for their situation. Have you kind of heard the same thing? Is there any validity to that?
Yeah, absolutely. I think that it can be expressed in kind of different ways. And I think also interpreting, like thinking about the situation that you're in and what you're feeling, just identifying that is really important.
Okay. I've also had a few caregivers share that they often fear what's going to happen next, or that the cancer will come back or get worse. In your experience, are there strategies to help cope with that fear that comes along with being a caregiver?
Yeah, I think that kind of goes along with the idea of sort of a loss of control, or that this sort of sense of uncertainty of the future. And it's a really common experience. I think that, people have gone through a cancer diagnosis and cancer treatment, and fear of recurrence or worry about the future is a really normal part of that process. So I think it's really sort of looking at the things that you can control and the things that you can't control in those types of situations. The things that you can control are, keeping up with your medical appointments, making sure that, you're communicating with your medical team, talking it out. Again, I know I keep coming back to talking it out, but that's really a really important strategy to sort of normalize those feelings. And I don't think that will ever magically kind of disappear, but I think we can give less weight to it and less focus on it, focusing a little bit on the here and now. Right now, if you're finished your treatment, I'm finished my cancer treatment. Right now, I don't have a recurrence. What can I do to stay in that present moment? So something like mindfulness can be a really useful practice to kind of mitigate those worries about fear of recurrence or fear of an uncertain future.
Can you share some more information about mindfulness, like some, I guess, techniques that they could try right away?
Sure. So, you could certainly look for, local organizations that provide mindfulness, but there are a lot of apps that you can get on your phone that will actually lead you to some mindfulness practice. But just general, some things that you can do very easily. A lot of times we equate mindfulness with meditation, and mindfulness is a part of meditation. They don't always have to go together. So you don't have to sit quietly for 60 minutes and meditate to get the benefits of mindfulness. So you can find mindfulness in a lot of different areas of your life. And one of the good examples that I always like to give is I'm a coffee drinker, so I love coffee. And sometimes, in the busyness of my morning, I will rush around and I'll really quickly drink my coffee and get to work. But you can practice mindfulness with anything like, a cup of coffee or something that you really like. And that's just sort of slowing down, focusing on that moment. And for me, when it's coffee, I'm looking at the coffee. I'm noticing the aroma. I'm feeling the warmth of the cup in my hand. I'm tasting it. I'm taking my time as I'm drinking it. Or maybe I find a favorite mug that I like the feel of it and I find a nice place to drink it. And I know it's a very small thing, but it helps you to really focus on some of the things that we might be missing in the current moment because we're thinking about, we have our mind in some other unknown future that doesn't exist right now. So it can be taking a mindful shower, or a bath if you're a bath person. And just really focusing on scents or the feeling of the water. So you can translate that to really kind of any area of your life. And it doesn't have to be a 60-minute mindfulness practice 7 days a week to get the benefits of mindfulness. It's sort of just tuning yourself in to the present moment.
I love that. I feel more relaxed just listening to the description.
Oh, good.
So grief and loss, they're often kind of linked to the loss of a person. However, several caregivers have shared that they grieve the loss of their identity and control. In your experience, has this come up with caregivers in your organization, and how might someone navigate this?
Yeah, a couple of really, I think, important issues to talk about. And again, the lack of control is something that we talk a lot about with our members. I think it's really helpful to focus on the things that we can control. So, maybe it's making a list. Here are all the things in my caregiving responsibilities that I can control, and trying as best we can to let go of some of the things that we can't control. And I think our brains are kind of wired to focus in on the negative things, to focus on the things that we can't control. So it's looking at it from the perspective of, what are the things in this situation that I can control? Can I get help? Can I, control when the doctor's appointments are, when the phone calls are, and having that sense of control and mastery over what's happening in the moment can really help to sort of decrease that stress that we feel when things are feeling so kind of out of control. In terms of loss of identity, I think, again, we do ask our caregivers a lot, and again, depending on the relationship, the situation, there can be varying degrees of that sense of loss of identity. So, for example, you may have someone who has had to take a leave from work to carry out their caregiving responsibilities. They may have had to give up not give up relationships, but focus less time on other relationships, or put aside some of the hobbies or interests that they have. And that can all of those things kind of make our identity, we sort of lose our identity in that way. So I think the suggestion that we would try to offer is, are there ways to modify or find some time to devote to the things that are important? And it kind of goes back to what I talked about in terms of, asking for help or getting help if you can. I think the key here is the flexibility. So looking at, what are the things that are important for me in terms of my identity? Say, for example, I really love to sing. Say you were a singer and you sing in a choir 3 times a week, and now because of your caregiving, your responsibilities, you're not able to do that. Are there other ways that you could meet that need of, identifying as a singer? Can you sing at home? Can you do something online? Is there some other way that you can connect to that piece of your life that's important to you, but maybe scale it down according to your circumstances? So I think the key here is the flexibility, looking at sort of prioritizing what are the most important things to you in terms of your identity and trying to stay connected to them in some ways that meets the circumstances that you're under.
Yeah, so kind of take some of the things that brought you joy before you were a caregiver and schedule them in now that you are a caregiver.
Exactly, yes.
Right, that makes sense. Oftentimes, though, caregivers share that they feel shame when they take time for themselves or ask for help. Is this common? Is there any way that we can work through that in a positive manner?
Yeah, definitely. And, again, really common. I hear that from a lot of caregivers. How could I possibly think about doing something for myself when I have this person in my life that I'm caring for, that has a cancer diagnosis, that may be, stressed or suffering, all of that. And, I think about, and many people have heard this oxygen mask analogy. If you're on the plane and the oxygen mask comes down, you have to put it on yourself before you put it on someone else. And I remember we had a member at Gilda's that I met just recently, and she'd heard that analogy, and she said that is the most ridiculous thing I've ever heard, because I don't have time to put the oxygen mask on myself. I am so busy with my caregiving responsibilities, I cannot think about myself. And I also, if I do take time for myself to do anything, I do feel that shame and guilt that I'm taking time away from that person. So again, similar to I talked about identity and finding that time, I think the key here is to adapt and find ways to find a little bit of self-care based on your current situation. So sometimes when people think of self-care, they think about it in big, broad strokes. I have to go to the spa for 5 days to engage in self-care, or I need to go on my 3-mile hike too. That's how I take care of myself. So can you look at the things that you find are re-energizing for yourself, or that bring you comfort or help you to manage your emotions when you're feeling stressed, and maybe scale those back so that they can fit in with your caregiving responsibilities. And an example that I can give you is I was working with a family who had a very sick family member, and the adult daughter had moved in to take care of her parent. And she talked to me about how she really loved to go for walks, and that was her way to mitigate stress and do some self-care. But she didn't want to leave her parents' side because they were so ill, and she had those feelings of shame and guilt about, I don't deserve to go for a walk. So we talked about, taking care of herself and so on, and we strategized. You may not be able to go out for an hour walk, but could you take a walk when when your father is sleeping, for example? Could a neighbor come in and sit with them for 20 minutes and you could walk around the block? Are there other strategies that you could put in place? Worst case scenario, could you go and stand outside and breathe in the fresh air and get the sun on your face? It's not a lot, but it's something. So I think the key here is some flexibility, some adaptation, and speaking to other caregivers. How do they manage this? How do they manage these feelings of isolation and shame and guilt when they're caring? It's a little self-talk, but knowing that other people feel that way often really helps them to manage those kinds of feelings.
Yeah, that's great. I also had a former caregiver that I was talking to a little while ago, and they say that they still struggle with the loss of identity and the big emotions that come along with caregiving, although they haven't been caregiving for months. In your professional experience, have you witnessed this? What can a former caregiver do to kind of cope with these thoughts and emotions that come up in caregiving?
Yeah, I think that's a really good question. And I think a lot of times when we're in the midst of these kinds of situations, when we're caregiving and we're all in, we don't really have time to process our emotions. And sometimes it doesn't really hit us until weeks or even months later. I think the important thing here is really sort of, as I suggested earlier, finding some kind of outlet to process that experience, and whatever outlet it is that resonates with you. Some people like to journal, or they may join a more formalized, journaling class where they can kind of explore their emotions and write them down and process them that way. Always connecting and talking with others, joining a support group, processing things with a counselor can be really helpful if they feel like they're really struggling after their caregiving responsibilities have ended. Just really allowing the space and time to process that, but also being kind to yourself and knowing that, it may take a little time to get through this. And I think in our culture where, we talk a lot about kind of getting through things really quickly and moving on really quickly, but giving yourself the space and the time to say, this will get a little easier with time, but it just may take a little bit of time, and connecting with others who've had a similar experience might really help to normalize and validate the feelings.
Yeah, that's great. So if individuals wanted to know more about the services that Gilda's Club offers, who would they reach out to, or can you tell us a little about what Gilda's Club offers currently?
Sure, I'd be happy to. So we do have a really comprehensive website. If you go to gildasclubtoronto.org, it will outline all of the supportive programs and services that we have. But I can just sort of give you an overarching view of the different categories of support. So we do offer group support. We have groups on all different kinds of situations and circumstances. We do provide a caregiver support group. We also offer some individual programs. We have a family program, children, teens, and families program, and we offer resource and referrals. So if there's something that we didn't offer at Gilda's, we're connected to other people in the community, so we can make referrals to other community-based organizations. We offer opportunity for social interaction. So if people are just looking to connect with other people in the community, people who've been impacted by cancer, there's an opportunity for social. And then we also provide educational programs and healthy lifestyle classes.
That's really good.
If you're interested in more service, interested in learning more about Gilda's Toronto, you can email us through the website. You can give us a call. All of our programs are of no cost to any of our members. Even though we use the term member, there's no membership fees. There's no cost for any of our programs.
That's really great. Thank you. So thank you so much for being here with us today, Christine. It's been a pleasure. Some key points that I've taken from today's talk is that it's equally important to care for yourself in addition to caring for others. Having a great support system is key, and kind of focusing on the now and what you can control and present is also important. Is that sort of on par with what you think?
Yes, absolutely. And I think one of the sort of the summary that I'd like to just say as well is just knowing that caregiving can be challenging, but it doesn't have to be isolating. There are really good supports out there. You don't have to go through this alone.
That's wonderful. Thank you so much. If anyone has any questions about today's Tush Talk or the services that Colorectal Cancer Canada or Gilda's Club offers, please email me at support@colorectalcancercanada.com, and I will make sure that you're provided with all the information that you're looking for. Thank you everyone for watching our Tush Talk, and we hope that we'll see you next time.